really. And she's currently working her PhD in Cambridge with looking at aspects of sort of pre-pregnancy factors. And she's going to present a very sort of topical subject considering the time of year it is, the poppy study. Thank you.
Thank you very much. I'll just share my slides. And I hope you can see that there now. Is that okay? So, thank you. So thank you very much for the introduction and very much for inviting today to talk. It's some fantastic work with Marcus and the whole team here at APEC. So thank you again. So I'm going to talk today about the poppy study. So on behalf of all the poppy investigators and Dr. Carmel McInerney and Professor Ian Wilkinson. And this is a fantastic study and I hope you'll agree at the end of the talk. So a bit of background, which I know that many on the call today will obviously know, but placental syndromes affect about 1 in 5 pregnancies, including pre-eclampsia, gestational hypertension and fetal growth restriction. And we know that women who develop these conditions in pregnancy have an increased associated cardiovascular risk later on in life. So you would assume that maybe it's the placental syndrome that's causing this long-term cardiovascular risk. However, from the Hunt study data, we can see that women who develop these conditions in pregnancy have increased cardiovascular risk prior to pregnancy. So higher blood pressure, higher body mass index, and higher waist circumference increases your risk of these conditions. And then if you account for this, you can reduce that excess cardiovascular risk later on in life if you attenuate for blood pressure and BMI. So really the question is it the placental syndrome that's causing the problem, or is there a preconception cardiometabolic health issue that is causing an increased risk in your developing placental syndromes, but then also ongoing risk of hypertension, diabetes, and cardiovascular disease later on in life? And that's where the POPPY study came in. So POPPY stands for preconception, as you can see there, to postpartum study of cardiometabolic health, and importantly, in the primogravid pregnancy. So in that first pregnancy, when we know that pre-eclampsia risk is at the highest. And it's sponsored by the Wellcome. So I presented this study a couple of years ago when we started, and it's very nice to see how it's come along since then. But just to remind people what we're testing for, so we're looking at women before their first pregnancy and their cardiometabolic health and seeing whether that increases their risk of placental syndromes, but also their postpartum health. And as part of this, we're collecting data, also looking at their general cardiometabolic health. We're looking at hemodynamic maladaptation for these placental syndromes, and then we can also look at the links with early fetal loss. And again, it's to try and see whether is there no relationship to the placental syndrome and it's all in your preconception health, or is it the placental syndrome that's causing those long-term risks, or is it a combination of the two? And also, again, from the Hunt study, we can see that women who have a normotensive pregnancy have a reduced blood pressure later on, and hopefully we can understand a bit more about that within this study. So we have 6 sites, with our 7th opening Liverpool soon. So we've got Glasgow, Manchester, Cambridge, and 3 in London. And what we're testing for, as I said, we're getting 3,500 women, so 3,000 women who are planning a pregnancy, planning their first pregnancy, and we see them before they become pregnant, and 500 who are not planning a pregnancy. And we see them before their pregnancy. We do their demographics, body composition. We do fairly standard cardiovascular tests of lipids, HbA1c, glucose, full blood count, U's and E's. And we also do their blood pressure, aortic pulse wave velocity, and carotid intermediate thickness. And for a proportion of those people, we'll be doing echocardiograms as well. And then throughout their pregnancy, they get these same investigations at 6 to 8 weeks, 18 to 22 weeks, 34 to 36. And then a subset of those people will follow up at 18 months postpartum. And what we're looking to see is whether women develop preeclampsia, gestational hypertension, or fetal growth restriction. And this is one of our colleagues, Lamoncoche, just doing some carotid intermediate thickness. So you can see they're all non-invasive tests that we're doing throughout pregnancy and before pregnancy. So the story so far, so this is what's been really exciting when I looked at the old slides from the last time we presented to A.Pec. So we've been recruiting nationally and locally. So we had some excellent work within newspapers, local radio, as you can see, Women's Hour, really getting the message out there about poppy. Because as you can appreciate, trying to recruit people before their first pregnancy, and so a stage where they may not want to tell people that they're planning a pregnancy, to ask them to come to a study is really quite tricky. We've been on local buses in the area. Obviously, APEC has been excellent at providing support for us and really shouting the message of the poppy study. And then locally, looking at things like posters on the tube, but also posters put up locally at hairdressers, coffee shops, gyms, you name it. We've been everywhere we can. We've also used social media quite a lot, so Instagram, X and Blue Sky and TikTok. And I have to really thank Rachel, who I think is on the call at the moment, who's been instrumental in providing us with some very lovely social media outputs, which has been really good and really well thought of, both by the women that come into Poppy, but also other people that we've seen that have used it. One of the aspects that we've used more recently is Natural Cycles. So this is a period tracking app, which when you switch from preventing pregnancy to wanting a pregnancy, they very kindly put up a note to say, have you considered the poppy study, which has been really vital, trying to capture people in that really sometimes short period between not wanting a pregnancy and planning a pregnancy. We've also done lots in the way of education in order to try and garner both education about pre-eclampsia, but also preconception health. And again, another way to try and get people to understand or at least know about the poppy study so they can come into it. And that has been things like local research groups, again, through our Instagram pages, through podcasts, through going to, this is a picture of our the South Asian network that we went to locally as well. Our PPI group for the poppy study has been instrumental. They have been amazing at facilitating changes in our advertising, the stories that they share, how we might present, and we've had some excellent patient stories that have come with us to research, so that we can present their stories, and really, as we've mentioned earlier today, about really understanding and treating the woman who's at the end of why we do all this research, and also to help us in future work and what their priorities are. So it's nice to say that the last time I presented, I think we had 52 people in the study, but we now have 1,259 in the study, just over 1,000 in our planning a pregnancy arm and 239 in the non-pregnancy arm. And I should say we've actually stopped recruiting to non-pregnancy arm just so that we can match those in the pregnancy arm, because we were recruiting quite well to that arm. And we've had 471 pregnancies and 208 births so far, which has been fantastic. As you can see here, we're looking at the way that we recruit. So this large segment here, a big part of that is Natural Cycles, so that period tracking app, which has been fantastic at helping recruitment. And like we talked before, Professor Chappell mentioned that we should be looking, when we're doing studies, we should be looking at our data that we're getting. Are we getting the right women that represent the nation, represent the research that we want it to show? And so what we did was we took sort of a part way through, we compared the women that were coming into the poppy study with the preconception health report card. So this was work done by Daniel Schoenecker and teams. It's some fantastic work. So they looked at preconception markers of health determinants of medical history taken from the booking appointment. And they whittled down to 32 different determinants. And so what we did was we compared some of these determinants that we captured in Poppy with Daniel Schoenecker's work to try and see whether we were capturing a good representation of the UK. So this is just some of the results. So this is looking at age. So these are all the different sites here. And then this is the England reference age, so that report card range. And as you can see, we are getting quite a range of people, a range of ages within the Poppy study. But I would say importantly, we're probably capturing a slightly older person who is not surprising, given that these are people that are planning a pregnancy. So we're missing slightly this younger cohort. In terms of BMI, again, I think we get very good representation across the board. We have more underweight representation than there is in the national data, but I think we still get a good representation of normal, overweight and obese as well. And then just looking at family history, cardiovascular risk. So this is looking at cardiovascular disease, history of pre-eclampsia, history of diabetes, and history of hypertension. And only within the report card do we have history of diabetes, so you can see there. But what I found was interesting is that obviously we know that hypertension is very prevalent, but a lot of women coming into the study have a family history of hypertension. So it may be that they are more aware of coming into studies to try and reduce their risk, but also risk in general. So when we compare the two, we can see that within England, the rates of smoking are much higher than we would have in the Poppy study, similar with unemployment and no preconception folic acid. But I would say it's quite surprising that we still have near 20% of women coming into a preconception study who are planning a pregnancy. And this is just looking at those that are actually planning a pregnancy in the pregnancy arm that are not on preconception folic acid. And I think sometimes the messaging around you should take it 3 months before pregnancy might mean that women are not taking it until they think they're within that 3-month mark. And we have a good representation of ethnic minorities and of the older age range over 35. But I think what's really striking is that nearly 93% of our Poppy women have got undergraduate or postgraduate degrees. We don't have a comparison with the health report card, but we can see that we have a good range of systolic and diastolic blood pressure, but we don't have those higher hypertensions that might be missing within and unknown about. So where do we go from here? So we know that 45% of pregnancies are unplanned, and so trying to get those women into a preconception appointment before that, we're unfortunately not going to be able to capture those. And equally, this is not all women. This is more women that are in socially disadvantaged, and the younger women who obviously less than 18 won't be coming into the Poppy study, but it is a different cohort of people that we're obviously just not capturing. And also those that don't have as an educational attainment, which again, as I've shown within the Poppy study, we've got quite a high educational attainment. So in thinking from our most recent meeting is that one of the aspects we're going to try and do is something called Poppy Light. We're thinking about the primary outcome. So it really is that first preconception visit and the postpartum visit. So somehow if we can limit the amount of data that we're gathering and try and go out to local groups and different socioeconomic groups, different areas of deprivation, to try and see whether we can still have people coming into the Poppy study that may not otherwise know about it, or be able to travel to the hospitals to come for their Poppy visit. So this is just where we're going moving forward, given, as I said, the analysis of the data that we already have. And I just want to say a big thank you to everybody that's involved in the Poppy study. It's a huge study and it's fantastic to be part of, but obviously, of course, all of our Poppy mums and the babies as well. And this is a QR code if you'd like to follow us on Instagram and also to have a look at the Poppy study there.
Thank you very much. That's a very interesting study, and you highlight a problem of starting from theory, but actually the patients that you get hold of for your study are not quite the ones necessarily you want. But that's a common study over a lot of areas. Unfortunately, we're running out of time, partly because I started you late, but there's no questions in the question and answer at the moment. So I'd like to thank you very much and wish you luck in carrying on with this. And we look forward to the next presentation of your results. Thank you very much.